All right, so we're here with the glutes. So here's our gluteus maximus. And if we press on that, we'll see our movement, how it extends the hip, and how it goes from a squat or a lunge with that knee bend. And we can see how the leg goes back behind it. That knee can go into a 90-degree angle and get that glute to work. We'll see how it attaches over here to the iliotibial band and the gluteal tuberosity. Beautiful muscle. And then here is that hip extension with a fixed thigh, and that is your deadlift. And we have some hip external rotation, which is probably where most of the overuse comes from, because if you're locked into that external rotation, it's going to keep that muscle short. And then there's some lateral rotation of the knee and a posterior pelvic tip. It works. I'm not going to say I like it as an exercise, but it does get this section in here to work. And then we also have contralateral rotation, where we're moving the opposite glute gets moved when we rotate. And then we have pelvic lateral flexion. There's that lateral line. Now they're on the standing leg, and you can also do this with the lifting leg as well. And then hip abduction, and there it is, that I just said that, and that's lateral line. And then hip adduction gets it from the lower section. So we've got a lot of movement on here. It's wonderful, wonderful large muscle. So we're going to go back to the rotate around here, there we go, and we'll remove. I did it again. Sorry. I'm going to go back. All right, let's remove a layer, and we're going to go up to gluteus medius. And so there is hip abduction, and it's going to prevent the pelvis from tilt down on the opposite side of a standing leg. So that's a pretty complex movement. So if you aren't straight through your hips, you can see how this muscle can get really overused. So if one hip is a little higher than the other, one side is going to be locked long, one side is going to be locked short. And then we can see how it attaches in here to that iliac crest and the ALA of the ilium. All right, and then let's go see if we can get to glute minimus. That's medius. There it is. All righty, and then here we have glute minimus, and we have that same abduction. So you can see all three of them work in abduction, which is that lateral line, that side movement. Hip medial rotation. So this is moving inward, and so this becomes, if one leg goes out and the other leg goes in, which sometimes happens where you have an imbalance at the femur, you may have glute medius on one side, glute minimus on the other. That becomes long, short, and the opposite, and that might not make a lot of sense to you, but if we have an internal rotation on the right and an external rotation on the left, or vice versa, glute minimus is going to be short on the leg that's turned in, and glute medius is going to be short on the leg that's turned out, and then vice versa with those legs with the muscles. And then it assists in flexion and extension. So it's there just giving a hand to it. So if extension, because glutes doesn't work in flexion, but if the big glute muscle isn't there, it's going to possibly get a little overused, or if quadriceps is not in a good place on the front of the leg and weak, especially on right hip dominancy, the left quadricep gets weak, the lateral quadricep on the left gets postural, and then this muscle may end up getting overused and create some pain at the front of the hip. All right, so there they are, the wonderful group of muscles. The hardest thing to do with these muscles is keep them in check with, there's lateralis, we'll go into that soon. Keep them in check with your hips. We can kind of see inside here, which is really cool. I'm not going to go there yet though. But there it is. There's that big glute, and you can see where it attaches in right here. You can see this is the part that hangs on people. And when we do some exercises, we'll get into that with some of the inner thigh squeezes. And then this area is the part that really works nicely in that outer thigh movement. And then we have our big squats and lunges are going to really come in and develop this center part really nicely. So there it is, Gluteus Group. All right, so we have gluteus maximus, which is a completely phasic muscle, and you can see how long these fibers are and how they're like that. Those spaghetti strands that I talk about, when they're not properly being used, they will sag, they will start to um, become very flaccid and atrophy. So here are our 3 trigger points, and we can see that the one closest to the rectum area does actually reference pain into the rectum. So we do have to think about these when we have odd pains. It is almost under, like the pain is almost at the trigger point. Same thing with the second trigger point. And this first trigger point up here is probably the one that has the least amount of pain at the trigger point site. But these aren't, in my experience, aren't as common. This is what Janet Travell calls the swimmer's nemesis, because swimmers use a lot of glutes because they're a big moving group. But if I find trigger points more than likely down here at number 2, I'm almost always going to look for a postural muscle that's not behaving properly, because these muscles should not have densities to them where, what you might call knots, because they're not that type of a muscle. So the trigger points are more than likely from overuse, and something like swimming would be a good example. And that's gluteus maximus, the largest and most superficial of the 3 glutes. All right, so this is glute medius, and this is the pseudo sciatica. Probably what most people come to me and tell me that they have sciatica in their hip, and it's actually gluteus medius, which is right here, kind of wraps around on the inside of, or the outside of that pelvic bone to the top of the femur bone. And we have 3 trigger points, and we can see that none of them really, except the one closest to the sacrum, has some radiating pain in that area. This comes around to the top. I have gluteus minimus as the fake SI joint pain, but this can also be what people think sacroiliac joint pain is. The sacroiliac joint is not a moving joint. It is fairly fused from a very young age, and it does not move. So the chances of that being dysfunctional are fairly slim to none. So most of the pain that you have in the sacroiliac area is from muscle, and more than likely from gluteus medius, gluteus minimus. If you didn't know you had them, now you do. And you can see from trigger point 2 how it's inward towards what people might look at as sciatica. And then back here for that sacral area, so there's ilium, sacrum, sciatica, sacral, iliac, and then sciatica. So this is all just trigger points in that area. Now, when I go into these trigger points, I will have most people loudly flail because they are very painful and they didn't realize they had them. So, and then all of a sudden they stop experiencing these pain patterns. So that is gluteus medius. And then here's glute minimus, which I'll call um, a another sciatic style, but more than that, it's going down the hamstring, the side of the leg, and you can see how it sprawls itself all over the side of that leg. And it has quite a few different trigger points. We'll go to the first two here, which radiate into the glute. And of course, we can associate that to the glute maximus too, with an associated trigger point, which can set that off. And then we go down, which a lot of people might say down my IT band. And of course, I've talked about the IT band is really a very connective uh, type of fiber. It does not harbor a lot of uh, nerve position with pain, but this does. So the minute you start pushing in on this, people will feel it go right down. You can see how red that is. It goes into the side of the knee and then down that peroneus or fibularis muscle. So it can be a lot of false pains for people, and a lot of therapists don't go to the side of the hip much. So I really suggest that you may ask them to do a side lying if you're experiencing pains like this, and then you can see all the small trigger points up here and how they're a little bit more radiated under the trigger point, and then they'll go down the hamstring. This is a really irritating trigger point. They're a little bit higher on the muscle, and they will go right to that hamstring. And of course, they can associate and trigger off the hamstring as well, and then into that calf. So this is an important group to go into side lying and really get into that muscle. Or if you don't have time for side lying, move laterally with the fist and try to maybe bring the opposite hand around the other side and get like a clamp onto that hip to get a little bit more leverage. And that's gluteus minimus. And we'll move forward from here.
All right, once again, we have the ball. We're going to be doing a pin and stretch on the gluteus group. You've watched the beginning of this video, so you have an idea where this muscle is. We're going to be going after gluteus minimus and medius because those are the ones that we're going to have the most problem with. Vladimir Janda has put these into a phasic category, but I'm not quite sure that minimus and medius are completely phasic. There may be a little bit of tonic or postural muscle fiber in there because they do tend to seem to get a little bit tight when they get weak. However, that's just a speculation that I have. There is absolutely a possibility that it's completely correct and that they are all completely phasic and that they're being overused and becoming postural. So it's a very deep muscle. It's very good to have it released. You're going to find that the left side is going to be very much active with trigger points, but the right side is actually the one that probably needs the release. So I'm going to show you how to do the release on the left side, but please do both sides when you do this. If you find that you have soreness at any of those trigger points, do both sides. Make sure that they seem equal. You're going to have them at two different angles. You're going to put the ball right at the hip for glute minimus, and you're going to roll downward on top of it so that it's just right at the front of that bone. You can bring your arm down, and then you're going to take the leg that's on that bottom and you're going to lift, and then you're going to release and relax and gently push the hip into the ball. You'll feel that muscle. Then relax it and then lift. And there's your pin and stretch. Relax it down, push, and there's your, that part of that neurokinetic where you're contracting the muscle onto the ball. Relax it, and then pin and stretch it, and then release it. Push down into the ball gently, relax it, and then pin and stretch it. So that's glute minimus. And then we're gonna move a little bit more sideways onto glute medius. We're almost to the top of the hip bone on that side fleshy piece. Lie down, and then you can do this with the leg in front now. Bend that back leg, push into the ball gently, relax, and then lift the leg up into the inner thigh. And then release and push, relax, and lift. Release and push, relax, and lift. Now I can feel that I have some trigger points in that muscle, which means I'm gonna activate them right now by doing this exercise. So be prepared if you do feel trigger points. Later on during the day, you may have activity in that muscle. Just ignore it, put some heat on it if it makes you feel better, and let it rest. It needs some time for those trigger points to move back down into being inactive, and then it's going to feel great tomorrow. And then you'll go to the second side and you'll do the same thing to the second side. There's going to be a 15-minute video that is going to follow this up in the level 1 series that is going to be just for glutes, focusing on gluteus maximus. So you're going to want to look into the level 1 playlist to do that workout.